name is Dr. PEDRO MARTINEZ-CLARK, and I'm an interventional cardiologist and a vascular specialist, and this is Amavita Health. So first of all, venous insufficiency is very common. It is estimated that about 30% of the adult population have venous insufficiency, meaning problems with the circulation on the venous side.
What are the signs and symptoms of venous insufficiency?
Now, if you have tingling sensation in the lower extremities, if you feel that your legs are heavy at the end of the day, if you feel cramps in the lower extremities or in the legs, or if you have seen or noticed varicosities or changes in the skin color or loss of the hair in the legs, those are signs or symptoms that you might have problems with the circulation, especially on the venous side. If you notice that you retain fluid and your legs get swollen at the end of the day, that's definitely a symptom and a sign of venous insufficiency.
How to diagnose venous insufficiency?
The diagnosis of venous insufficiency is actually very simple. First is the history and physical examination, signs or symptoms that are consistent with that condition. And then there is a simple ultrasound, which is very simple to do and does not hurt. One of the most important treatments for venous insufficiency is radiofrequency ablation. The procedure is done under local anesthesia, is done in the office, basically painless. The recovery is immediate, there is no downtime. In this procedure, we insert a very thin catheter in the vein using ultrasound guidance. And with this catheter, we can administer energy to the vein, eliminating the veins that have reflux and incompetence, and basically the veins that don't work. This procedure takes only a few minutes, is very safe. At the end of the procedure, once successful closure of the target vein has been confirmed, the catheter is removed from the body and a compression stocking is applied to the patient, which will be worn for 48 hours. But basically the patient can return to work or to normal activities immediately. So that's ablation. And we're looking at the seconds, we're looking at the temperature, we're looking at the wattage. By looking at those parameters, we know exactly the contact time and parameters that are important for a successful ablation. Venous insufficiency is caused by insufficiency or problems with the reflux in the greater saphenous vein, and that's almost always the first vein that we treat. At this point, the patient didn't complain at all, very comfortable procedure. We pulled the catheter, and that's it.
My name is Ed. I'm 50 years old. I have been a registered nurse for 18 years. My job has me on my feet all day long. About 3 years ago, I noticed some varicose veins on my left leg. I finally decided to undergo a venous ablation and 1 session of sclerotherapy with Dr. Martinez-CLARK. The procedure was fast and painless. Within 10 minutes, I was out of the office. Within 2 weeks, the results were amazing. I highly recommend this procedure with Dr. Martinez-CLARK.
Venous insufficiency or varicose veins are caused by a combination of hereditary factors as well as lifestyle. For example, if you wear high heels or if you have a job or an occupation where you stand up for long periods of time, You might experience a wear and tear of the veins of the lower extremities. In other words, the structure of the walls of the veins become weak, they dilate, and then the pressure in the lower extremities increase, causing all these symptoms and signs of venous insufficiency. One of the areas in medicine where we have seen most advancement in the last decade. In the past, the treatment of problems with the circulation with the veins used to be all surgical. Today, we have incredible treatment options that we can do and offer to patients in the office without any surgeries, with immediate recovery. It is covered by most of the insurance plans. Depending on the spectrum and depending on how advanced the condition might be, you might be a candidate for one of these therapies that we are able to offer to you today.